There is something important I want you to understand about foodborne illness, especially if you are over the age of 60 or are caring for someone whose health is already fragile. A bowl of salad may look fresh. A handful of berries may look perfectly clean. A glass of water may appear completely clear. Yet none of those things tells us whether a microscopic organism is present. One parasite in particular has become an important public health concern. Its name is Cyclospora, and although most people have never heard of it, the illness it causes can continue for weeks and place older adults at serious risk of dehydration, weakness, falls, kidney problems, and hospitalization. I do not want this information to make you afraid of eating fresh food. That would not be helpful. I want you to understand where the real risk comes from, what symptoms should never be ignored, and what simple decisions can help protect you and the people you care about. Cyclospora cayetanensis is a microscopic parasite that infects the human intestinal tract. It is not a virus, and it is not a bacterium. A virus must enter our cells and use those cells to reproduce. A bacterium is a living single-celled organism that can grow and multiply under suitable conditions. Cyclospora is a more complex organism with its own life cycle. That life cycle explains something very important about how the infection spreads. When Cyclospora leaves the body of an infected person, it is generally not immediately ready to infect another person. It usually needs time in the environment to mature and become infectious. This is one reason direct person-to-person transmission is considered unlikely. That does not mean hygiene is unimportant. Anyone experiencing diarrhea should wash their hands carefully after using the bathroom, and caregivers should always wash before preparing food or assisting another person. But Cyclospora does not normally sweep through a household through casual contact in the same way that some highly contagious stomach viruses can. The greater concern is contaminated food or water. Cyclospora outbreaks have often been associated with fresh produce that is eaten raw. Depending on the outbreak, this may include leafy vegetables, fresh herbs, berries, or other fruits and vegetables that receive little or no cooking before they are served. The contamination may begin in the field. It may involve irrigation water. It may occur during harvesting, washing, cutting, packaging, transportation, or preparation. In some cases, investigators may need weeks to identify the source because modern food distribution is extremely complicated. The salad you purchase from a supermarket or order at a restaurant may have traveled through several locations before reaching your plate. It may have been grown in one area, washed in another, cut and packaged at a processing facility, and then distributed under several different store or restaurant labels. This is one reason foodborne outbreaks can appear unrelated at first. People may report eating at different restaurants or buying food from different supermarkets. Yet several products may eventually lead back to the same ingredient or processing facility. It is important, however, not to confuse an investigation with a final conclusion. During an outbreak, health authorities may examine certain products, suppliers, farms, or processing facilities without immediately declaring that one of them is responsible. This distinction matters. Public health communication should be based on evidence, not rumors. When an official recall or food safety warning is issued, follow it carefully. Until then, avoid treating an unconfirmed company, farm, restaurant, or product as guilty simply because it is being investigated. To understand how contamination can begin, we need to talk about water. When people hear that a parasite may have been found on lettuce, herbs, or berries, they often think of the produce as the original source. But the produce may simply be the vehicle that carried the parasite. Water can be the pathway. Some agricultural crops are irrigated with water from rivers, reservoirs, canals, ponds, or other exposed sources. Surface water can be affected by sewage leaks, damaged sanitation systems, runoff, flooding, animal activity, or contamination occurring upstream. If contaminated water reaches a crop, microscopic parasites may remain on the surface of the produce. From there, they can travel through the supply chain and eventually reach a person who eats the food without cooking it. This means an outbreak linked to produce may also be a water contamination problem. The two possibilities are not necessarily separate. The water may contaminate the food, and the food may then carry the parasite to the consumer. We have learned throughout history that water does not need to look dirty to be dangerous. It can appear completely normal while carrying organisms that are invisible to the human eye. Modern sanitation, water treatment, agricultural standards, and outbreak surveillance have made our food and water far safer than they were in the past. But safer does not mean perfect. No monitoring system catches every problem immediately, and agricultural water does not always receive the same treatment as drinking water supplied to homes. The point is not to become suspicious of every glass of water or every vegetable. The point is to recognize that food safety begins long before food enters your kitchen. Now let us talk about the illness itself. The most common symptom of Cyclospora infection is frequent, watery diarrhea. Some people also experience stomach cramps, bloating, gas, nausea, loss of appetite, fatigue, headache, mild fever, or unintended weight loss. One of the most frustrating features of this infection is that the symptoms may seem to improve and then return. A person may feel better for a day or two and assume the illness is ending. Then the diarrhea, cramping, and weakness begin again. Without appropriate treatment, this pattern may continue for several weeks. For a younger and otherwise healthy adult, the experience can be exhausting and unpleasant. For an older adult, the same illness may become dangerous much more quickly. As we age, the body does not always respond to fluid loss as effectively as it once did. The sensation of thirst may become weaker, so an older person may not feel thirsty even while becoming dehydrated. Kidney function may be reduced. The body may also have more difficulty maintaining stable blood pressure and electrolyte levels. Many older adults take medications that affect fluid balance. Diuretics, sometimes called water pills, increase urination. Certain blood pressure medicines may contribute to dizziness when dehydration occurs. Other medications may affect the kidneys or change how the body handles sodium and potassium. This is why several days of diarrhea can have consequences that reach far beyond the digestive system. A person may develop a dry mouth, dark urine, reduced urination, dizziness, muscle cramps, rapid heartbeat, unusual weakness, low blood pressure, confusion, or excessive sleepiness. Dizziness and weakness also increase the chance of falling. For an older person, a fall can lead to a fracture, loss of independence, or a long hospital stay. In someone with heart disease, kidney disease, diabetes, cancer, or frailty, the body may have even less reserve. That is why persistent watery diarrhea after the age of 60 should never be dismissed as something that simply needs to run its course. Many people ask whether the immune system can eliminate Cyclospora without medication. In some otherwise healthy individuals, the answer is yes. The immune system may eventually control the parasite and clear the infection, but the word eventually matters. A person may be biologically capable of recovering and still become dangerously dehydrated during the process. They may lose weight, stop eating properly, become weak, or experience recurring symptoms for weeks. The fact that an illness can resolve naturally does not mean waiting is always the safest choice. A healthcare professional can determine whether Cyclospora is a likely cause, whether stool testing is necessary, and whether treatment should be prescribed. Cyclospora may not be identified unless the clinician and laboratory know to look for it, so it is important to describe the symptoms clearly and mention any recent travel, restaurant meals, fresh produce consumption, or public health warnings in your area. Older adults, people with weakened immune systems, those undergoing cancer treatment, and anyone living with a serious chronic medical condition should seek advice early rather than waiting for the illness to become severe. Medical attention is especially important when a person cannot keep fluids down, urinates very little, becomes confused, feels faint, develops severe weakness, has intense abdominal pain, notices blood in the stool, or shows other signs of significant dehydration. Blood in the stool is not considered the classic symptom of Cyclospora, so it may point to another condition that also requires medical evaluation. While waiting for medical guidance, Hydration becomes the immediate priority. Small and frequent sips are often easier to tolerate than drinking a large amount at once. An oral rehydration solution may be more useful than plain water because diarrhea causes the body to lose both fluid and electrolytes. However, people with heart failure, advanced kidney disease, severe liver disease, or medically prescribed fluid restrictions should not dramatically increase fluids or sodium without asking a healthcare professional what is appropriate for them. This is an important example of why general health advice must always be adapted to the individual. Now let us consider what can be done in the kitchen. The most reliable household method for reducing the risk from Cyclospora is thorough cooking. Heat provides a protective step that raw produce does not receive. During an active outbreak involving fresh produce, cooked vegetables are often a more cautious choice, especially for an older or immunocompromised family member. Vegetables can be steamed, boiled, roasted, or thoroughly sautéed. The goal is not to remove vegetables from the diet. The goal is to choose a preparation method that reduces risk while preserving nutrition. Fruits that can be peeled may also be reasonable options. Bananas, oranges, mandarins, and avocados have outer coverings that are removed before eating, but there is a mistake I often see people make. They assume that because the peel will not be eaten, the outside does not need to be cleaned. Imagine placing a melon on a cutting board. The edible part is protected inside a thick rind, but the knife must pass through the outer surface before reaching the flesh. If the rind carries contaminated soil or water, the blade can pick up that contamination and drag it directly inside. The same thing can happen with melons, cucumbers, mangoes, avocados, and other foods with an outer surface that is removed. Before cutting firm produce, rinse the outside under clean running water and gently scrub it with a clean produce brush. Dry it with a clean towel. Then use a clean knife and a clean cutting board. Do not wash fruits and vegetables with soap, bleach, disinfectant, or household detergent. These products are not designed to be swallowed, and residue may remain on the food. Commercial produce washes are also not a guarantee that a parasite has been eliminated. Washing fresh produce remains worthwhile because it can remove dirt and reduce some surface contamination. But washing should not be confused with sterilization. Cyclospora can be difficult to remove completely from fresh produce, particularly leafy vegetables and herbs with folds, creases, or rough surfaces. A long rinse or vinegar soak cannot be relied upon to make contaminated produce completely safe. Freezing should not automatically be treated as a guaranteed solution either. Home freezing conditions may not reliably eliminate the parasite. When a specific raw product is named in an official outbreak notice, the safest response is to follow that warning rather than attempting to rescue the food by washing, soaking, or freezing it. You should also pay attention to cross-contamination. If unwashed produce touches a cutting board and cooked food is placed on the same board, organisms can move from one food to another. A knife used on unwashed produce can also contaminate food that is ready to eat. Wash your hands before preparing food and after handling unwashed produce. Clean knives, cutting boards, counters, and utensils with hot soapy water. Keep washed produce away from unwashed produce. Refrigerate cut fruits and vegetables promptly, and discard anything that is moldy, slimy, badly damaged, or stored at an unsafe temperature. These steps cannot eliminate every possible risk, but they reduce several common pathways through which foodborne illness spreads. People also ask whether they should stop eating meat or fish during a Cyclospora outbreak. Cyclospora cayetanensis is considered a parasite of humans and is primarily associated with contaminated food or water, particularly fresh produce. It is not generally linked to properly handled meat, poultry, or fish. That does not mean these foods are free of all risk. Raw poultry, undercooked meat, seafood, and eggs can carry other dangerous organisms, so normal safe cooking and handling practices still apply, but there is no reason to assume that every food in the kitchen presents the same Cyclospora risk. Household pets are also not considered a typical source of human Cyclospora infection. Your dog or cat is not the main concern in this type of outbreak. Knowing what is unlikely to cause the illness can help prevent unnecessary fear. Another question people frequently raise is whether herbs or natural remedies can treat the infection. Traditional medical systems have used plants for digestive illness and parasites for centuries. Some plant compounds do show antimicrobial or antiparasitic effects in laboratory or animal studies. Turmeric and its major compound, curcumin, are often discussed because researchers have explored their effects on inflammation and certain microorganisms, but this is where we must be very careful. A result observed in a laboratory dish or in an animal does not prove that the same substance will treat Cyclospora safely and effectively in a human being. There is no responsible basis for telling someone to replace diagnosis and established medical treatment with turmeric, garlic, bitter herbs, or concentrated supplements. Supplements can also interact with prescription medicines. Some may affect blood clotting, blood sugar, the liver, the kidneys, or the digestive system. A product marketed as natural is still biologically active and can still cause harm. Using turmeric as a normal ingredient in food is not the same as taking a high-dose curcumin supplement. The safest approach is to view this research as scientifically interesting, not as a substitute for medical care. For anyone caring for an older family member, I recommend having a simple response plan. If diarrhea begins, do not rely only on memory. Keep track of how often it is happening, how much the person is drinking, whether they are urinating normally, whether they have a fever, and whether their alertness or balance has changed. This information can help a healthcare professional understand the severity of the illness. Pay attention to subtle behavioral changes. An older person may not say, "I am becoming dehydrated." They may simply appear more tired, less interested in food, unusually quiet, confused, or unsteady when standing. Some people minimize their symptoms because they do not want to worry their families. Others feel embarrassed discussing diarrhea. A person who is already weak may not recognize how serious the situation has become. Do not wait for them to ask for help during a confirmed outbreak. Consider temporarily serving more cooked vegetables and fruits that can be cleaned and peeled. Be cautious with salad bars, raw herbs, pre-cut produce, and foods specifically named in official health notices. But do not remove nutritious foods from an older person's diet without replacing them appropriately. Undernutrition is also a serious health risk. The goal is not to create a restrictive diet. It is to make safer choices until the source of the outbreak is understood and the warning has passed. There is a broader lesson in all of this. The food on our plates moves through a long and complicated system. It begins with soil, water, seeds, farm workers, and harvesting equipment. It may then pass through washing stations, processing facilities, packaging lines, trucks, warehouses, stores, restaurants, and finally our kitchens. Each step can reduce risk, but each step can also introduce another opportunity for contamination. No consumer can personally control the entire food supply chain, but there are several decisions you can control. You can follow official recall and outbreak notices instead of relying on rumors. You can choose cooked foods when the risk from raw produce is elevated. You can wash the outside of produce before cutting it. You can prevent cross-contamination in the kitchen. You can recognize dehydration before it becomes severe. And you can take persistent diarrhea seriously, especially when it affects an older adult or someone with a weakened immune system. The goal is not to become afraid of food. The goal is to understand that food which looks clean is not necessarily the same as food that has been handled safely. Cyclospora is microscopic, but the protective steps are practical. Cook food thoroughly when possible. Clean produce before cutting it. Keep your kitchen surfaces and utensils clean. Stay aware of official public health guidance. Replace lost fluids carefully. Watch vulnerable family members closely. And seek medical advice before weakness, confusion, or dehydration turns a manageable illness into an emergency. Good health decisions rarely come from panic. They come from paying attention, understanding the risk, and acting early enough to protect the people who may not realize they are in danger. Please take care of yourself and check on the older people in your life. Sometimes one careful conversation, one prepared meal, or one timely call to a healthcare professional can prevent a much more serious outcome.